There is a strong connection between diabetes and obesity and the increased risk of Alzheimer's disease. Alzheimer's currently affects 5.4 million Americans, and this incidence is expected to reach over 13 million by 2050 without a medical breakthrough in prevention and treatment. In parallel, there is a 35% increase in people with diabetes and obesity in the last 25 years. It is estimated that almost 40 million Americans currently have diabetes, and 2 in 3 Americans are considered overweight or obese. Compounding these alarming statistics, multiple studies report that patients with diabetes and obesity are at an increased risk of developing Alzheimer's. For example, studies show that there is an association between dietary fat intake and increased risk of Alzheimer's. And the patients with diabetes have a 50 to 75% increased risk of developing Alzheimer's. Despite these associations, however, the mechanism connecting these conditions are mostly unknown, and there are no effective treatments currently. Therefore, it is imperative to understand the connection between these 2 pandemic diseases that are diabetes and obesity and Alzheimer's. By using cell culture and animal models, I am trying to understand how diabetes and obesity affect specific proteins involved in the development and progression of Alzheimer's. For cell culture models, I grow nerve cells in petri dish. Using these cells, I can more precisely control the condition replicating the metabolic syndrome and examine the molecular changes in the cells. For example, I treat the cells with a high concentration of fat or glucose and examine the changes of amyloid precursor protein and tau. These 2 proteins make the plaques and tangles in the brain, which are the most prominent pathological markers of Alzheimer's. I also induce obesity in mice by feeding them with a high-fat diet or use genetic models of diabetes. I use various behavior tests as well as biochemical studies in the brain to examine the effect of diabetes and obesity on cognition. My research clearly demonstrates that obesity and diabetes induce the biochemical changes resembling Alzheimer's in both cells and brain, as well as facilitate the cognitive defects in animals. By continuing the research using cell culture, biochemical analysis, and animal behavior studies, I hope I can contribute to the progress to find the prevention and cure of Alzheimer's disease related to the modern Western lifestyle.